Hello and welcome to Just the Facts Podcast. This is your April 17th, 2020 update. I'm your host, Dr. Michael Bechill, and welcome to the Coronavirus Podcast that talks about what's going on around the country, what's happening in your neighborhood, but most of all, focused on just the facts. On today's podcast, I'm going to give you a preview of our upcoming episodes, talk to you about how you can submit your questions. We'll have an in-depth talk about P.P.E. given by my virology students. We'll answer some of your questions about P.P.E., give you some updates on the P.P.E. shortages, as well as talk about some job loss that we're seeing because of P.P.E. issues. First off, I'd like to talk about the preview of upcoming podcasts. So here, what I've tried to do is lay out a timeline of our future podcasts and when you can be expecting them. So episode 6 will be coming up on the 19th, and that'll be just a local Hoosier update where we try to give you local information about Allen County, about Fort Wayne, and the surrounding communities. Episode 7 I'm really excited about. It's called Taiwan, Showing Us the Exit. So we're going to do an in-depth look into how Taiwan was able to stop the SARS-CoV-2 outbreak in its tracks and how they're able to effectively basically avoid death, avoid the spread, and get back to work. Really exciting topic there. Episode 8 is going to be talking about mutations and evolution of the SARS-CoV-2 vaccine. We'll do another weekly update for episode 9. Then episode 10 on May 1st, we'll be talking about experimental SARS-CoV-2 medications. Should be a very interesting topic. And then episode 11 on May 1st or May 2nd, we'll finish up again with another Hoosier local update. So what I'm going to be doing here, as you can see over the next few weeks, is giving you some very focused topic episodes as well as some local updates to keep you in the loop of what's happening here in Allen County and Fort Wayne. Also, I want to just remind everyone a very easy way to submit questions to us, which will be answered either by me or by my class, is to just go to this website here, slido.com. You can go to it on your mobile phone. You can go to it on your laptop or any other electronic device. And the first thing that it's going to say is type in your event code. And you just type in that event code for the next week. You'll be able to use the code 46501. Then you could submit your questions, and my class or I will answer that questions for you. So again, check out slido.com and enter event code 46501. And I'm really excited about today's show because we are, again, having students from my virology class on to talk to us about a new topic. And today's topic is going to be about P.P.E., what works and what does not. Our first guest today is a junior pre-med student in virology. His name, Jordan Constanti, and is joining us from South Bend, Indiana. Thank you so much for coming onto the show today, Jordan.
Thanks for that great introduction. I'm glad to be here.
Awesome. So today we're going to be talking a little bit about P.P.E., but we want to start off with general information about P.P.E. And where I would like to start off is just kind of step one. What exactly is P.P.E. and why is it important?
Yeah, so Dr. Bechill, P.P.E. stands for Personal Protective Equipment. And it's any equipment, clothing, or anything in general that's worn to reduce the risk of exposure to hazards that can cause any illnesses and injuries. This equipment is not limited to one particular field, but rather can be applicable to any situation that has the capacity to cause injury and harm to somebody. This can range from broad categories, from things like studying a virus in a lab or working on an electrical circuit for an apartment complex. P.P.E. reduces the chance of injury to the person that's working, and it's extremely important, especially as the risk of the activity increases. Not only is it important for personal safety, but P.P.E. is important if you want to keep your job. P.P.E. is actually regulated by something called OSHA, and if you don't know, OSHA is the Occupational Safety and Health Administration, and OSHA aims to protect employees from these hazards. They set standards forth that must be obeyed by both the employee and the employer. The employer must provide the employee with the correct PPE and training to use said PPE. And if these regulations are not followed, it can result in termination of the employee and, in some severe cases, even jail time for the employer.
Interesting. So far you've talked a little bit about why PPE is important, but what kind of equipment actually qualifies as PPE?
That's a great question. But honestly, the types of PPE are endless. It can range from complex ventilation systems to provide employees with clean air, to gloves to reduce the chance of getting a splinter for a construction worker. Like I said earlier, PPE is considered anything that can be used to protect an employee. With that in mind and the broad range of PPE to choose from, we must know how to select the proper PPE. Initially, the employer must anticipate the type of exposure that the employee will be generally exposed to. And these kind of exposures fall under different categories, such as touching a biological agent, splashes or sprays, body fluids, and different kinds of secretions. Once these categories are selected, the PPE must be made sure that it is durable and appropriate. So, for example, if I'm trying to prevent being exposed to some form of body fluid, I need to make sure that the gown I'm wearing is waterproof. Finally, the PPE must be fitted correctly. In some cases, such as with the N95 mask, which we'll talk about later, if the PPE is not properly fitted, then it just doesn't work.
Interesting. Now, you mentioned at the level in which an employee may be exposed to a hazard. What did you mean by this? Are there different levels of protection?
Actually, there are different levels of PPE, and this is according to the different hazards that are presented. As you can see on the screen there, starting with the left, there's level A, level B, C, and D, respectively. I'm going to start explaining what level D is because it provides the least amount of protection. Level D is usually just a work uniform and only requires the coveralls and the safety shoes or boots to be worn. In some special situations, like with a construction worker, you may need something like a hard hat. Level C is used when the risk of an airborne substance is known and is measured, and the criteria for air purifying respirators is met. Along with this, there may be some form of low risk to your skin and eyes, and this usually only requires some form of chemical resistant clothing. You can have inner and outer chemical resistant gloves, and like I said, the form of respirator. Level B is the second highest, and it's used when the skin and eyes do not need much protection, but the respiratory tract still needs the highest level of protection. This includes positive pressure self-contained breathing apparatus, so that's like a scuba suit, but for on land. And again, both inner and outer chemical resistant gloves and boots, and a chemical resistant suit. And then finally, level A is used when the highest level of protection is needed for your skin, eyes, mucous membranes, and just any part of your body in general. And this usually includes a positive pressure self-contained breathing apparatus, a chemical protective suit covering your entire body, both the inner and outer chemical resistant gloves again, and then you want chemical resistant boots. The interesting thing about this last kind of protection is that the employee has no risk of being exposed to any hazard whatsoever. Everything that's inside of the suit stays inside the suit, and everything outside of the suit stays outside of the suit.
Excellent. Thank you so much for that general information. That was very, very helpful.
No problem.
Now, next on the show, we are going to welcome Hayden Sprin, joining us today from Antwerp, Ohio. Hayden is also going through my virology class, and he is a pre-PA major. So he's going to eventually go into the physician assistant program, and I think he's hoping to join our program here at St. Francis. How are you doing tonight, Hayden?
Fantastic. Thanks for having me.
Excellent. Thank you so much for coming on today. And I was hoping that you could kind of elaborate a little bit on the background information that Jordan gave us. So with all these different levels of protection, are the hazards classified in a similar way? We just talked about the different classifications of suits. Now, are the hazards actually classified in a similar way as well?
Yeah, so with hazards in a lab scenario, we typically talk about biosafety, which is the application of safety precautions to lab work in order to reduce exposure to various microbes or biological agents, and also in order to limit the contamination of the work environment and the larger community outside of the lab. Now, there's 4 levels of biosafety. The higher the number, the greater the risks, and each has specifications for lab practices, safety equipment such as P.P.E, like we've talked about, and even facility construction and setup. And all of that is for the safe containment of the microbes and biological agents. Now, these levels are assigned based off risk factors for each pathogen, such as infectivity, the severity of the disease, etc. Other factors are important too, like the origin of the microbe, the agent in question, and the route of exposure. And now, before I move on, and I'll delve into this more, but it's important to understand that bacteria and viruses of the same species can have different strains with varying degrees of harm, and that can shift them between these biosafety levels. For example, some strains of E. coli don't cause diseases in humans, and they can be worked with under BSL-1 conditions. But another strain can cause human disease, which warrants BSL-2 precautions. But anyways, we can look deeper at the specifications for each BSL, starting here with BSL-1. Under BSL-1 conditions, the microbes are not known to cause human disease, kind of how I just talked about the non-pathogenic strain of E. coli. Therefore, in BSL-1, you're exposed to minimal potential hazard, and lab practices can be performed at an open bench. P.P.E requirements consist of lab coats, gloves, and eye protection, and the only requirements for the facility are an available sink for hand washing and doors separating the workspace from the rest of the facility. We typically see BSL-1 labs in high schools, so let's move on to BSL-2 now. In BSL-2, the microbes pose moderate hazards as they are now associated with more severe diseases. So here we would see workers working with Staph aureus or HIV, and here lab access is actually restricted, and PPE includes the same, such as lab coats, gloves, and eye protection, but now the inclusion of face shields as another important piece. All procedures that pose risk are performed within a biosafety cabinet to limit aerosols or splashes, and the tools and utensils are actually autoclaved and decontaminated for proper disposal. Facilities have self-closing lab doors and a sink and an eye wash station. And we'll see next with BSL-3 how these precautions increase. In biosafety level 3, the microbes are either indigenous or exotic, which is important when considering how a native host may respond to a foreign pathogen. And these microbes can cause serious or fatal diseases through respiratory transmission. So we're looking at things like Mycobacterium tuberculosis or West Nile virus. Scientists who work in these settings are under medical surveillance and might even receive immunizations against the microbes they're working with. Lab access is restricted and controlled at all times. PPE precautions are higher, as researchers must wear self-contained respirators, and all lab work must be performed in an appropriate biosafety cabinet or a fume hood, which you can actually see on the image on this slide, and that limits spread by air of the pathogen. These BSL-3 facilities also need hands-free sinks, eye wash stations near all exits, and an air exhaust system that sustains fresh airflow through the facility so there's no air recirculation. Again, all doors must be self-closing and they must be able to lock. And finally, now we can look at BSL-4, the highest level. Microbes in this setting are dangerous, exotic, and pose high risk of aerosol-transmitted infections that are often fatal without treatment or vaccines. These pathogens would include things such as the Ebola and the Marburg viruses. In order to enter a BSL-4 lab, workers must change clothing before entering and don a full-body, air-supplied positive pressure suit, which can be seen in the image on the slide. They must shower upon exit and decontaminate all materials and surfaces before leaving. A Class 3 biosafety cabinet is used, and the lab must be isolated either as a separate building or a blocked-off restricted zone of the same building.
Interesting. So now that our viewers have a general idea about these different biosafety levels, what does our current SARS-CoV-2 virus fit into out of those 4 levels?
So the novel coronavirus strain that we're all familiar with now actually has multiple strains, which we'll cover in next week's podcast. And the biosafety level actually varies with the strain, but it's typically between BSL-2 or BSL-3. But like I said, I don't have information on the strains right now, so we'll cover more in the next podcast.
Excellent. So you've covered PPE, how it relates to biosafety level in lab scenarios, but how does PPE actually perform in other situations?
All right. So, yeah, before we keep recommending them, it's important to understand how masks and respirators perform in households, healthcare, and other settings. And here, I also want to differentiate between source control, which is actually worn to protect others, and PPE, which we've already said protects the wearer. So if we transition, we can kind of look at cloth masks as source control. This began around the late 1800s, first as patient source control, and then additionally, or afterwards as PPE for nurses. A study was actually performed by Kellogg, the founder of the cereal company, and he investigated the reason for public required cloth mask failure during the 1918 influenza pandemic. And in that study, he found that the number of cloth layers needed to be acceptable or efficient with these masks actually reduced their breathability and caused leakage around the masks. And nowadays, there haven't been any other well-designed studies of cloth masks as source control in household and healthcare settings. But we can move on and talk about surgical masks as source control. There have been household studies that find very limited effectiveness in reducing respiratory illnesses in other household members. Perhaps this is because they're not worn constantly. Clinical trials, however, in the operating rooms surprisingly find no difference in wound infection rates with or without surgical masks, but surgeons don't give up this long-standing practice.
Wow.
Other lab studies suggest that they are effective at blocking large particles and minimizing lateral dispersion, which is airflow side to side out of the mask, but they do increase emissions upward and downward from the mask. And some evidence suggests that there's efficacy in reducing overall particle emission from patients, and we see around reduction rates of respiratory viral infections in patients, visitors, and healthcare workers when they're all wearing surgical masks. And nowadays, a really big topic recently, we can look at the N95 respirators as source control. And I want to say first off, the National Institute for Occupational Safety and Health, which is the NIOSH, they say that untrained users will not wear these respirators correctly. Non-fit tested respirators are not likely to fit, and improvised cloth masks do not provide the same level of protection of a fit tested respirator. So with that being said, a few studies examining respirators on coughing subjects showed greater efficiency at limiting the lateral particle dispersion over that of surgical masks, especially in comparison to no mask at all. And patients in this study reported that the surgical masks were more tolerable than the N95s. And now the N95s as source control for patients, public, or household use is not recommended, especially during this current pandemic, because they may not be appropriate, especially with the current extreme shortages of the devices needed in healthcare. Now we can look at cloth masks again, this time as PPE. And I myself read one trial comparing the effect of medical and cloth masks on healthcare workers that stated that illness rates were more likely with cloth mask wearers than those wearing medical masks. Moreover, a cloth mask's poor filtration and performance mean that there's nearly no protection for healthcare workers inhaling the infectious particles when they're near an infected patient, which is why we see surgical masks instead as PPE in healthcare. And I found several trials that have not found any difference between surgical masks and N95 respirators at lowering respiratory disease outcomes for healthcare workers. But I also found some more recent studies that have found that the N95 offered a higher protection against clinical respiratory illnesses and lab-confirmed bacterial infections, but not viral infections. And meanwhile, another analysis I found compared medical masks, such as surgical masks, against, it found that healthcare workers continuously wearing N95 masks were much less likely to experience respiratory viral infections over controls which weren't wearing the masks, while the surgical mask wearers were only slightly less likely. So surgical masks may offer very low levels of protection for the wearer from aerosol inhalation, but a face shield would probably be more appropriate for this concern. And lastly, we can look at the N95 respirators as PPE. I found one study, it involved nurses, and it found that the nurses' risk of SARS infection was lower when they consistently wore their N95s, and it was improved over consistent use of surgical masks. And this lowered risk was attributed to data showing high filter efficiency and a better fit. Therefore, with the current outbreak of SARS-CoV-2, it's so important that N95s be reserved for more individuals in healthcare and have a proper fit.
I really appreciate that history, because I think the history and the studies that have been done is really important to talk about, because you've mentioned you mentioned the fact that these cotton masks or even surgical masks generally aren't all that effective with viral infections, and I appreciate that information, because I think that information really does need to be out there, the differences that these masks have in terms of performance. So thank you so much for bringing that up.
You're welcome.
Now, you mentioned the N95 respirator specifically. When should these actually be worn during our current pandemic?
That's actually a fantastic question. I see personally a lot of confusion regarding what PPE should be worn and under what situations in our current state. Currently in the hospitals, as you can see on the screen there, full PPE precautions are underway. Employees who have the risk of being exposed to the SARS-CoV-2 virus are expected to wear a gown, gloves, face shield, and an N95 respirator. Now, since the N95 respirators are in such high demand, we're currently seeing a drastic shortage of these masks. And when employees don't have access to them, they're expected to wear surgical masks instead. Now, surgical masks definitely do not provide the same level of protection as the N95 respirator. This is due to their loose-fitting appearance, but they do block large particles and droplets, such as splatters or splashes. Along with this, they also reduce saliva and respiratory secretions, which can help protect the patients and other employees in case the employee wearing the surgical mask is currently infected with the virus. Now, you might ask yourself, why are these N95 masks so special? So the 95 of the N95 stands for that the masks protect against 95% of airborne particles that are at least 0.3 microns in size. But in order for this to be accurate, the N95 respirator must be fitted. Now, there's many different sizes and styles of N95s, and people using the mask must be fit tested once per year to ensure that they remain comfortable and functional. There's a few different ways that they can be fitted. As you can see on the screen there, there's a special piece of equipment that can be hooked up to the mask, and it measures air intake and air output to see if the mask is working correctly. Or there's a test that relies on the wearer's sensory detection. The wearer might be exposed to some form of taste or smell, and if they can't detect it, then you know that the mask is working. Now, I think the most important thing of all is that the CDC does not recommend that the general public wears the N95 respirator. Like was said earlier, most of the general public is not fit tested for these masks, so even if they are wearing them, they're probably not wearing them correctly, or that they're not fitting correctly and their effectiveness is greatly reduced. These masks should be reserved for healthcare workers that are in the most risk and at the highest need for the masks.
And I agree with that statement completely. It's amazing. Every day I see pictures posted either on social media or video on the news of just news clips of people showing other people wearing masks in public, and they're just doing it wrong. And they're of no value, of no protection if they're not fitted properly. And I also like the other point you brought up of people not, you can't have facial hair. You cannot have facial hair and have a proper seal with an N95 mask. So I think those are two just incredibly important points, and I thank you very much for covering that. Now, the next kind of thing I was wondering is if the N95 masks are in such kind of short supply, what's being done to combat that issue?
That's a great question, and I'll answer that. So N95s are disposable, but they aren't technically single use, like something such as a surgical mask, because surgical masks are actually recommended to be disposed after around half an hour of use or an hour or so. But with N95s, respirator loading may occur over time as the filters become loaded with particles and it becomes harder to breathe. But this is most common in mining or construction scenarios. In healthcare, however, this loading is not likely to occur before the respirator itself is actually compromised through multiple donnings over multiple shifts, where you see something like the straps wearing down or the nose clip losing its proper fit. And I found one study that showed increasing rates of fit failure as the number of donnings increased. And this same study also found that the fit was most consistent for the first 5 donnings, and the failure rates increased much more after 15 donnings. It's also important to note that while extended use of respirators is addressed by the CDC and the NIOSH as a possible strategy to improve the supply of respirators with this current outbreak, decontamination of respirators is not addressed by those organizations. Decontamination of respirators is not an approved practice by the CDC, the NIOSH, OSHA, or the FDA. Modifying a respirator actually invalidates its NIOSH certification, which is required by OSHA for employees to even wear the PPE in the first place. Respirator manufacturers have even stated that decontamination is not acceptable for their respirators, but during a pandemic, the rules can change slightly. So acceptable decontamination methods must render the pathogen on the respirator non-viable without limiting the filter and fit performance. It must not limit the respirator integrity, its structure, comfort, odor, and even the fit, the wear of it. So in my research, there were 2 viable methods I found for decontaminating N95s. The first of which was ultraviolet germicidal irradiation, which involves placing respirators under a UVC lamp to disinfect any exposed surface. But this requires masks to be flipped during some point or have a 2-lamp setup that gets both sides. And for respirator filters treated with SARS and MERS viruses, no viable virus was found following this ultraviolet treatment, and no impact happened on the filter performance. Additionally, ultraviolet treatment did not compromise the fit of the N95s. However, testing a much higher doses of ultraviolet light decreased the filter's efficiency, but it still remained above 95% efficiency, so just a slight hit to it. Strength of the different respirator layers decreased at all doses of ultraviolet light, with more layers showing decreased strength with increasing doses. The breaking strength of straps also decreased at all doses, but respirators treated with a single dose showed no difference from untreated respirators in odor, donning ease, comfort, and fit. Therefore, while respirator filter performance and fit were not adversely affected at the higher doses, the lowest dose level caused a loss of strength of at least 1 filter layer. So extending this ultraviolet treatment beyond 20 cycles, say, might not be appropriate. And next up, the second method I found was hydrogen peroxide vapor decontamination, which involves uh, PPE to be placed either in a room or near a device that generates hydrogen peroxide vapor, and that vapor itself helps to kill any bacteria or viruses on it. And it's assumed that a dose sufficient enough to deactivate bacterial spores would be enough to deactivate less hardy viral organisms. But I found no data available for the exact dose required to deactivate the SARS-CoV-2 virus. And I looked at 2 studies, and in both there was no significant reduction on filter performance. After 20 cycles of this hydrogen peroxide vapor decontamination, there was no difference in fit between treated and control respirators, but there was a noticeable and significant damage to the straps. Regardless, neither method of decontamination has been widely approved by any of these organizations, despite any of these promising results.
Interesting. So, I mean, fantastic information. You gave us a lot of, studies and research that's been done onto this. And so just to kind of rehash that just a little bit. And so, you're saying after five repeated uses of a mask, you see failure rates that start to increase up to, would you say 53% after 5 uses?
I'm trying to look back through my notes here. I don't know. The percent that I talked about was decreased filter efficiency with the ultraviolet testing.
Okay. But, it's still incredibly valuable information that, we can reuse these masks. We can clean them either with that peroxide treatment or the UV treatment. But even with those treatments, we're still going to experience some failures, especially when it comes to fitness after reuse. So I think that's something that we need to talk about and the public needs to be aware of. So thank you so much for that information. Next, we're going to invite onto the show a returning guest, Irish Starkey. You might remember her from episode 2.5. So welcome back to the program again tonight, Irish, joining us from Albion, Indiana this evening. Thank you so much for coming back.
Yeah, it's my pleasure. Thank you, Dr. Bechill.
So so far, the 3 of you have really provided us with loads of information on how important PPE is, how it's applied, who should be using it, when you should be using it. But are there any misconceptions or assumptions that people are making when using PPE?
Yeah, so because there's a lot of variation going on, there are definitely like misconceptions and assumptions that cannot be avoided. So we provided some of them. So like the first one, somebody would say, if my staff won't wear PPE, I can't make them. This is actually not true because PPE is always going to be necessary to ensure safety. So it's not optional that you can't make your workers wear it. And employers must be aware that they have every right to require the use of it because it is a way to reduce the exposure of hazards. And then many might assume like because it provides a lot of protection, maybe like the more PPE they would wear, the better. This might not be true because overprotection, also underprotection, they can be both dangerous, where overprotection, it can lead to stress from wearing too many layers, and then the underprotection can also lead to chronic health problems because you have less PPE and now you're being exposed more to hazards. And then wearing PPE, when you're trying to find which level of protection will provide you the best protection, that is totally up to you, and that is also totally up to like what kind of PPE must be used in the task that you are trying to do, and then depending on what the PPE is made of. And then another one might say gloves are slippery, they can't get a good grip. There are other options out there where they can find gloves with textured finish on the fingertips, where they can be easier to grasp and lightweight object. And then if somebody can't wear gloves because they have a latex allergy, there's also another alternative where it can be nitrile, neoprene, or vinyl. And then when a person would say, this job would only take a minute, like they would say, I can skip putting on PPE. This one might be a very, very dangerous claim because it only takes a second for an accident to occur. So regardless of how long you're going to use the PPE, it's important to realize that, when you're wearing PPE, you are reducing the likeliness of you getting injured or possibly getting into like deadly situations. So it's definitely necessary to wear PPE at all times. And then because of like the variation, people might assume that one piece of PPE is good enough. It's not true because of the fact that, there's regulation that must be followed at all times. So organizations like OSHA, NIOSH, FDA, and CDC, they provided like recommendations on what kind and how much PPE are you going to use for the different for the type of task that you're about to do. And then lastly, cleaning and storing, some might assume that it's not that important. It is very, very important to ensure that, not only is it safe, but it's also properly used. And then when somebody is using it afterwards, then some PPE must be cleaned and stored properly according to the manufacturer's instructions, because if the PPE is damaged already, it becomes dysfunctional. And then when it becomes dysfunctional, this is just opening to some health hazard. So organizations are always advising to replace the damaged PPE immediately. So coming up, we provided questions that people might wonder about the PPE. So in the first one might ask, can I use PPE more than once? So most PPE are designed to be used once, so these are single-use PPE, and they're used by one person, and they're disposable. But there are some exceptions that can be included. So some respirator masks and protective eyewear, such as goggles, you can use that more than once because they are reusable. However, when decontaminating them, you have to like read the product labeling. But if the PPE is exposed to infectious materials already, so like when you are working with infected person, that like their bodily fluids are considered infected. So if the PPE is exposed to that, it is already considered contaminated. So you should remove that promptly. And people also need to be aware that, even if the PPE is successfully protecting you, if you are using it improperly, removing it improperly, or like disposing it improperly, you are still posing a risk to being exposed to the infectious agent. And then when it comes to sharing PPE is usually not advised because it's a single-use PPE. If that's used by more than one person, that is only like decreasing the capability of PPE to protect, and then it's only increasing the exposure to hazards. And then some PPE, such as the N95, you can't share that with another person because of the fact that it has to be fitted to to your face. So obviously not every one of us has the same sizes of faces, so it's recommended not to share PPE such as that. And then some of the exemptions that I found is that safety glasses, hard hats, and safety vests, they can be reused only if they're disinfected properly. Also in hospitals, there are gowns that are meant to be washed, disinfected, and reused. However, when it comes to proper maintenance, people just need to read about how it must be cleaned properly. And then many might wonder, like, can you still wash a disposable PPE? This is not advisable because it's only used once and only by one person. Washing it just changes the protective capabilities, and it's actually reducing its effectiveness. And for example, if you're washing gloves, it becomes unsafe because the washing might not be able to eliminate the organisms that your gloves is already being exposed to. It's also making it prone to tear or leaking. And then with a lot of variation, one might wonder, does every piece of PPE like provide the same level of protection? So PPE is designed to be used with other infection control practices such as hand washing, using alcohol-based hand sanitizer, and like covering your coughs and sneezes. So when it comes to determining the same level of protection, we must understand that each PPE is different because it is designed depending on what task it can protect you from. And those who wear it, they can determine the level of protection that the PPE is rated according to the standard that it has been tested.
Excellent. Thank you so much for that information. Now you're going to be kind of providing us some updates. And so there is this worldwide issue concerning PPE shortage. We hear about, people don't have enough PPE in different settings each night. Can you elaborate on that just a little bit more for us?
Yeah, so like with the pandemic, when the pandemic like got worse, there was a shortage going on and then the World Health Organization actually warned this because there's an increasing demand because more people are getting infected, and it just so happens that we're doing panic buying, hoarding, misusing it, and then it's just putting people's lives at risk of like the SARS-CoV-2 and other infectious diseases as well. And then with the shortage happening, it becomes dangerous because this only makes the healthcare workers ill-equipped, especially when they're caring for patients who are positive for the COVID-19, because now they have limited access to gloves, masks, respirators, goggles, and then face shields. And then one of the things that I also found is that because of the shortage, the prices increase, and then there's like an unsecured supply chain. So supplies takes months to deliver, and then stocks for it are frequently sold to the highest bidder. And then I also found that US has been making fewer masks, gowns, and gloves domestically. They're mostly relying on importing those items from other countries. And ironically, China is manufacturing roughly 50% of the masks and respirators around the world. So with the factories being at halt because of the lockdown, there's already fewer masks being made. And that's just intensifying these shortages. And then I found that history may have played a role for like US being not as prepared as we want it to be. So unlike China, Singapore, and South Korea, US wasn't hit hard by the SARS in 2002 and 2003. So there was that like lack of like a lot of awareness about the novel coronaviruses. And then the World Health Organization did a modeling to try and figure out how much PPE must be used during this pandemic. And they found an estimation of like 89 million medical masks must be provided for the COVID-19 response each month, and then 76 million for gloves, and then 1.6 million for goggles. And to boost this production, they're working with governments, industry, and pandemic supply chain network to meet the global demand, and they're estimating the manufacturing to be increasing by 40%. And with the shortage happening, they are recommending conservation strategies. So the FDA is recommending these, but these strategies are not covering N95 respirators, and they're not limited in using for caring for COVID-19 patients. So they recommended that people must use PPE that are FDA cleared. And then when it comes to gowns, try to use reusable gowns instead of disposable gowns. And then in times where we have limited access to surgical masks, there is a consideration of wearing the same surgical mask, but remove the used gloves and gowns, and then always perform hand hygiene afterwards and at all times when it's necessary. And then because of the shortage and then trying to meet that global demand, they are warning people to be aware of a counterfeit PPE where it might look the same, but it's not as effective as it should be, because apparently that's out there. And then if PPE is not available, the NIOA, OSH, and the OSHA have actually issued standards and recommendations for protective clothing, like based on the fluid barrier properties. And then for Indiana, when it comes to PPE shortages, there's 1.9 million pieces of PPE that have been purchased, and as of April 13, this is going on, and then 15 Indiana companies are actually making PPE. So for example, Tide Demon Bevs typically make caskets, but now they're making gowns. And then Royer Corporation, they make restaurant and bar furniture, but now they're making face shields. So it definitely shows how companies, even though they're not making PPE originally, they're working together to like boost that production. And then the Indianapolis Colt, Toyota, Westfield Outdoors, and Acclaim Graphics, they have donated some of the 150,000 pieces of PPE that have been received this week. And then the National Guard has also been very helpful in picking up and delivering PPE. And in GDC in Goshen, they're currently making 30,000 plastic face shields a day. And then although they serve Toyota, Ford, and GM. So we have this trend going on where typical companies that are like normally not making PPE, they're actually making time to make the PPE because they to like address the shortage, which I think is a very great way to see how people are working together just to help us like get through this pandemic. And then we found that with the shortage, like there's alternatives going on. So on the coming up, we found a bandana cloth-based covering that the CDC was recommending. So in this one, we are just showing like a tutorial of like how you can make the bandana. So you would need 2 rubber bands, and then you can cut the bandana in like using a coffee filter. And then while this is a cloth mask, it's not as effective as a surgical mask. However, it's just like a way to basically contain the respiratory transmission in case you're sick, and then it's better than nothing.
Yeah, no, and I'm going to be doing another podcast here in a few days. I'm going to be doing another podcast here in a few days about that exact story, is how using these face coverings, even if they aren't surgical masks, can help prevent it. And we're going to showcase kind of Taiwan as how that story is played out. Now, I have been reading a lot of articles. You guys have done a fantastic job of outlining the importance of PPE and why we're wearing it and the protection that it confers. But I've been reading a lot of articles about healthcare workers actually getting fired because of issues surrounding PPE. Are they not using it properly? Why? What's going on with this? This seems like an interesting turn of events in a time of need like this.
Yeah, so when I was looking up in these articles, I was actually really surprised because healthcare workers are like the first responders, but then finding out that they're getting fired was a little bit of a shock to me. And the common reason why they're getting fired is because of the fact that they're speaking up about the lack of gear and PPE that's being provided by the hospitals. So now, because of the PPE shortage, like I said, they're ill-equipped to care for their patients. And then among the healthcare workers, this becomes a concern because they want to make sure that their patient as well as them are safe when it comes to caring, because this virus is very infectious. And then some of them have even tried to find ways to use PPE. So some of them would try to bring PPE from home. I found that there was a nurse from Virtual Hospital. She brought her own N95 mask and a pair of gloves. And even though the hospital did not approve that, she was more concerned of how her hospital was inadequate when providing PPE while she was working. So she said that she does not feel adequately protected, so she did not want to take off the mask that she brought from home. But then the hospital defended their action of not letting people take masks from home, saying that they were just following CDC guidelines and they were just providing N95 masks to nurses who were actually treating COVID-19 positive patients. But then a week after they fired that nurse, they changed their policy and they were actually allowing nurses to bring N95 masks to work, but then they have to be covered with their own isolation masks and then daily discarded. And then doctors and nurses are now dying from it because of the lack of PPE. And then there's even more workers that are getting sick from it. There's a doctor from Peace Health, St. Joseph Medical Center in Bellingham, Washington, who pleaded on social media for better protection for patients and staff because he thinks that when you see something wrong, you have to speak out. And he was basically just worried. But then the hospital responded by firing him. And then there was another doctor in the Weill Cornell Medical Center who shared how doctors are not allowed to bring PPE from home. And their defense was saying that it's issuing appropriate PPE and it can't allow doctors to bring their own PPE because they they don't know where it came from, and they don't think that it's not as safe as the one that they provided. And some are even just getting fired for, like just warning colleagues in general about like the standard face mask that the hospital is providing. A Chicago nurse was fired from that. And then even just wearing masks in public places in the hospital. There was an anesthesiologist in Texas who got suspended without pay because he was just wearing a mask in public. So hospitals are trying to say that they're committed to safety. They want to make sure that the workers and patients are safe. But then at the same time, with these articles showing how healthcare workers are getting fired for the lack of PPE, it basically forces the workers to speak up, because now like the hospitals are now failing to fulfill that goal of ensuring safety. I thought it was just so ironic because of the fact that these are first responders. They're taking the time to be out there and care for these patients, but then when they are showing their concern, the response from the hospitals that they're working at was just termination in general. So I think people just need to be aware that like healthcare workers are now being a target for that.
Yeah, it's a very sad situation that we're seeing in different parts of the country. Luckily, I think so far we've been very fortunate here in Fort Wayne that all the reports that I've heard from workers at Parkview and at Lutheran are that though there is some reuse of PPE going on, we haven't run out of supplies. Unfortunately, some of these people in other hospitals around the country have actually physically ran out of gear and PPE. And I think that's we're fortunate here in Fort Wayne right now that we still have the supplies that we need. And I think kudos to our local health systems for keeping us out of the news in this aspect, right? We're not seeing Fort Wayne plastered all over the headlines on this specific part of the topic. So I do appreciate the information, because I think it's important that in healthcare, it's really important that you advocate for the patient, but you also have to protect yourself. You can't help patients if you yourself get sick. And so I think it's a very important thing to talk about since we're talking about PPE. So I'd just like to say thank you one last time to Irish, Hayden, and Jordan for coming on the program today. Absolutely fantastic information about PPE, its uses, and its limitations. Really great work. One last reminder, here's our upcoming future podcast schedule. Mark your calendars, and I'll try to give you the best content that we possibly can. Also, I'd like to one more time thank the virology class at the University of St. Francis for helping me put several of these podcasts together. Don't forget to ask your questions. Really easy. Head over to that Slido website, slido.com. Just enter in that 46501 code for the next week. That'll be good for the next week's podcasts, and we'll be able to answer your questions. And so just today in review, you really got to get a feel for PPE, what works well with it, what doesn't work with it, limitations, what gets used in the hospital, what gets used out in the public. Can we reuse them? Can we clean them? A lot of valuable information. Thank you so much for tuning in today, and remember to stay home, stay safe, and take care of yourself. I look forward to seeing you soon. Have a good one.